This is the middle ear and outer ear. How it works? It's so simple to understand that the process of convergence, condensation, sound waves are being collected from the auricle. This is the auricle. This is various shapes in different faces. It collects sound waves from a bigger area and transmit through canal exactly on the very tense, very taut. It's not relaxed. It's very tense and taut eardrum. That's plain. It's concave if you see from outside. It is a finely fabricated eardrum exactly on the outer ossicle, that is the malleus. And from this much big area of auricle, sound waves are condensed, converged, doing something like very active movements, gymnastic-like movements, circus-like movements, monkey-like movements. All movements are possible, only possible because of semicircular canals. Semicircular canals. These three canals as three right-angle dimensions are nicely fabricated, constructed for dynamic and active balance. So outer ear and middle ear is collection of sound wave system exactly into the inner ear and organ of Corti that's finally having hair cells, inner hair cells, outer hair cells that transmits sound waves in the form of micro electrical currents into the cochlear nerve. And from static balance and dynamic balance, impulses are passed through vestibular nerves to the brain stem, exactly at the junction of pons and medulla. So we should remember simply outer ear, middle ear, and inner ear, how it functions. So we should remember that ear is not only for hearing, for resting balance, for dynamic balance, and more so for everybody. These special senses are on the face, on the human face. After vision, hearing is the most important sense. The other two special senses are also in the nose and throat. Human face is masterpiece of God. Never touch the face of others without permission. It's not allowed. So hitting the face, slap on the face can lead to perforations, can lead to many problems. These are serious injuries. So one thing for female especially, if you want to have piercing of the auricle, it should be by a qualified doctor under absolute germ-free, clean environment. It just needs sterilized skin and monofilament. It should be done in a clean operation theater-like situation under local anesthesia. It's having no perhaps charges, but it should not be done at a street level by a common man. Otherwise, infections and disfigurement can happen. Please take care of when you get the piercing of the ears. It should be avoided at the early age before 12, and it should be minimum. If you have to get it done, it should be done by a doctor. Most common query everywhere is, what are the main causes of deafness, hearing loss? Because it's a special sense. This sense is not only for hearing. Dear friends, it's for the communication as well. I speak the way I listen. If I listen very clearly, I can speak nicely. My feedback system of hearing tells me that how loudly I should speak out. If you are present face to face, I am looking at you, I will change my voice from time to time so that we are nicely connected with each other. So speech and hearing is a nicely connected special sense. If I can't hear well, I can't speak. If I can't hear at all, then I will not be able to speak at all. That's not possible. That is called deaf mutism. So hearing, having a normal hearing is absolutely necessity, mandatory. It is compulsory for speaking and maximum growth of human mind and human development. We can ask each other how we diagnose, how we investigate a case. Usually you will be asked queries like this. If a baby is born and he's not hearing, he may have a similar picture like this. 1-year-old baby, 6 months old baby has good eye contact, smiles, but doesn't speak, not attracted towards various sounds. How you will diagnose or how you will investigate. So we have to be very much fine person now as a doctor, how we'll start looking into this matter. You can think for a while. We will immediately investigate or diagnose. We immediately won't go on the causes. Second query, in the same way, 1-year-old baby has good eye contact, smiles, but doesn't respond to sounds and unable to speak. We may be asked how to treat or manage. So investigate is different, treat is different, management is different. So please look into the question in Viva, in questionnaire, what has been asked for. How you will investigate a case, how you will diagnose a case. Any query, any problem-based learning, you will start with a precise history. It's the same Hutchinson's, Hamilton Ballet's clinical history. Listen, listen, listen. Listen carefully to the patient. If we listen to the patient carefully and don't dictate the patient, don't override, you will get the diagnosis within no time. If you spend more time, more nicely, in a good ambience, good communication, then certainly your diagnosis is mostly right. So precise history will be asked, what happened during pregnancy, during birth, even afterwards. So after history, we'll have a very nice clinical examination of the ear, inner ear, middle ear, external ear, and so is the nose and throat, because many nose and throat issues leads to infections inside the ear through eustachian tube. Investigations of the ear diseases. These are the audiological tests, hearing tests, examination under microscope. If the pus is coming, some fluid is coming from the ear, we'll ask for having culture and sensitivity. So we should know many words. Every time we ask for investigate, we'll take precise history, we'll have exact clinical examination and relevant investigations. Diagnosis after precise history, clinical examination, and all these investigations is called diagnosis. And that is our final diagnosis. how will we treat such a case? That is the second part. We reassure the patient that human medical science has gone a long way. A lot of knowledge is explored. Every day in future, new things are coming on the surface. After 5 years, the knowledge is doubled. So we have to get realities in our computer on and on. We reassure that much can be done, and 99% of the diseases related to deafness can be nicely tackled, controlled, can be treated with very simple measures. Medical treatment is always a first option after explaining the disease of the patient to the attendant or parents. Sometimes patient needs hearing aids. There are 5 different types of hearing aids. Later on, we'll like to discuss. Sometimes there's a fluid in the middle ear or some basic problems. Then we have to add some surgical procedures. So treatment is usually reassurance, counseling, medical treatment, simple appliances like hearing aids, and surgical treatment. Sometimes patient needs long-term follow-up, and if the patient is not having absolutely non-functioning cochlea, then cochlear implant can be implanted, having a great success story in the last few decades. Management means everything from history, clinical examination, all sorts of investigations. Treatment is a preventive treatment and follow-up. If you comprise the whole scenario, whole panorama, whole persona of the disease, then it's called management. So precise history, clinical examination, all possible investigations for that particular disease, treatment, prevention, follow-up. Sometimes in cancerous diseases, you have to have long-term follow-up in most of the patients. Management means, so you may be asked, investigate, diagnose means same thing. We may be asked treatment. Treatment means directly we'll go for the reassurance, medical treatment, and surgical treatment. If management has been asked for, we'll go through all the aspects of the disease. We'll go through a fine history, relevant clinical examination, required investigations, treatment, prevention, preventive treatment, and follow-up of the disease. There are various types of deafness. Conductive deafness, that is relevant with the outer ear and middle ear. All the diseases relevant with the external ear and middle ear are conductive deafness. For example, the ear is blocked. If ear is blocked by the wax, by the fungus, by the pus, by the infection in the outer ear or middle ear, that is called conductive deafness, because the conduction process has been stopped. Or if there is no external ear congenitally, or if there is no ear canal, it also falls in conductive deafness. Sensory neural deafness, that is sensor and the nerve. Sensor here is a cochlea. If there is problem in the cochlea or the nerve, for example, there is agenesis, hypogenesis. Congenitally, in first 10 weeks, most of the organs are developed. If something wrong happened during these days of intrauterine life, during pregnancy, in first 3 months, then certainly patient can have many organs deformed. So first trimester is the sacred month, sacred time of pregnancy where one has to take extra care from infections, from medicines, from stresses, and the expected mother should be respected like anything, taken care of anything, and especially the diet. So infections, medicines, very good diet, and especially the mental health, mothers, expected mothers, especially in first pregnancy, where a young girl is not knowing very well, should be respected and taken care very specially. Patient can have mixed deafness, outer ear and middle ear and inner ear, everything is deformed. That could be congenital diseases in the mixed, that is something like otosclerosis, that is another example of deafness. So various of deafness is conductive, sensorineural, and mixed. If we see here carefully, external ear is part of the face, and human face is masterpiece of God. We should round the clock try to smile with or without any reason. If you keep on smiling and it's your habit, and mostly you're having very good things to be shared with your friends, with your seniors, with your family members, then you're a very positive person of the society. We are all inclined towards either positivity or negativity. In 24 hours, there are around 70,000 sound waves coming in our mind. Mostly 60-70%, around 70%, these are negative. So to keep ourselves positive, we have to make a try. To smile, we should try. It's a choice. So please keep yourself happy, keep smiling. Human face, especially the special senses, we are talking about hearing, vision, it should be taken care like anything from day one. So that 2 years is not a luxury, it's a necessity. 2 years not only tells us from where the sound is coming, it exactly tells us that from how much distance that sound is coming. And this sound is very attractive for you, or it's not. For example, at your age, many sounds will be so good for you, you want to listen round the clock. So please keep up your smile. I'll focus on that. If the patient is having only one ear or one eye, that is something very sensitive issue. Only eye, only ear is just like only child. If this is lost, then the life is really ruined. It's a dark and the darkest for that particular person. So at that time, the medicine in that eye, surgery in that eye has to be very, very careful, very careful. Common causes of hearing disability. Consanguinity. In congenital, in inheritance, a very common cause is cousin marriages. Cousin marriages in a family where already hearing problem is cumbersome, troublesome, already there, please take care of. That's very serious issue. Cousin marriages in our part of the world is a common cause of hearing loss. Secondly, we have to think infections. All types of viral and bacterial infections can reach in the middle ear, inner ear, brain connected with the hearing process in the form of meningitis, especially tuberculous meningitis. Tuberculosis, TB is so common in our part of the world. So we have to take extra care. All these are very common causes of infections. Drugs are blessings for many, but you should be sharp enough, fine enough how to play with the pills. Your advice tells you, your writing tells how much intelligent you are. So we should know many drugs like aminoglycosides, salicylates, quinolones, quinines, antimitotic drugs that are very detrimental, very dangerous for your inner ear. That leads to almost total deafness, initially reversible after some time, it's dose dependent, it could be permanent. So describing drugs, especially painkillers in elderly patients, where already patient may have diabetes, you should be very careful in asking for NSAIDs, anti-inflammatory analgesics. बूढ़े लोगों के अक्सर पेन होता है, जोड़ों में होता है, they keep having, and this is very, very toxic drug. So trauma, noise-induced hearing loss, aging process, that's normal with some age groups. 10 to 20% patients after 65 of age may require some sort of hearing aid for hearing to be normal. So the common causes you can narrate is a congenital, cousin marriages, viral and bacterial infections in the middle ear. Typhoid, tuberculosis is also a very common cause. Medicines, especially aminoglycosides and quinines, chloroquines, and trauma. Direct head injuries leading to unconscious always end up with some sort of major disability. Presbyacusis, aging process can lead to hearing loss. Common causes, we can just show you a few detailed pictures. Viral infections, we all have experienced mumps in our childhood. Mumps, measles are the most common causes of hearing loss in early childhood. So it could be bilateral mumps, it could be sometimes unilateral, it could be sometimes second attack in adults. So mumps is a common cause of unilateral profound hearing loss. Measles, moderate bilateral sensorineural hearing loss. Cytomegalovirus and rubella hits the pregnant mother. It can lead to serious disabilities, congenital aberrations. One has to remember both of these. Middle ear infections, otitis media with effusion. The other name is glue ear. We'll talk about it in immense detail. It's a middle ear infection having sterile fluid in the middle ear. It's acute suppurative otitis media, where infection is very rampant, extensive. It's causing pain, fever, and deafness, and later on discharging ear. Chronic suppurative otitis media, meningitis, both pyogenic and tuberculous, and typhoid. All these are very common bacterial causes. These are the bacterial causes of hearing loss. What leads to these infections quite often? Feeder and the feeding bottle. This is a very common cause of respiratory tract infections in early age group. So a child for a family is a blessing. It's a new model. It's an angel-like new landing in the universe. Certainly both parents, especially the first baby, parents should have a lot of good knowledge not to use the feeder. Feeding bottle is a big source of infection. Human nipple is more clean, soft, and more adaptable, more adjustable for the child. The biggest blessing is mother and mother's feet. So try to promote breastfeeding. Try to avoid bottle feed. Both of these should be fed. The feeding process should be absolutely not in lying posture. It should be in the sitting posture. Baby should be sitting or in the semi-sitting posture, exactly having body contact with the mother, and mother is looking nicely, smiling into the eyes of the baby. And during the act of suckling, during the act of feeding, baby should not sleep. Baby should not sleep. Baby should be active, like Acute army man. It should be a very active process. It should not be a sleeping pill. If he'll sleep, he may inhale a lot of good milk into the chest, and this is a big source of infection. Right? Time and again and again, recurrent infections in the chest. And if we feed the child like this, the way the gentleman is trying to, the milk is going directly into the nasopharynx and into the middle ear. And such infections, once occur, will take many, many months to sort out. So feeding, breastfeeding should be promoted. It should be avoided. And feeding should be conducted in the sitting and semi-sitting position. And the baby should be continuously touched somewhere on the face and head. And the mother, it should not be at the expense of maids, please. It's a very serious business. Mother should leave everything but feed the child on her own. And if she is too busy, then father should take the responsibility, and they should be doing it themselves with absolute clean and good ambience environment, having some fragrance that it looks to be doing something like a very good job. Otitis MediaWithEffusion, glue ear. One of the commonest infections in the middle ear is otitis MediaWithEffusion. Mostly the patient presents in the form of delayed hearing loss or small issues in the ear. Here there are infections time and again in the middle ear. What the parents are doing, the mother is very familiar, she's a doctor, she always gives some antibiotic. For 2 days, 3 days, baby is fine, again stopped. This poorly treated infection stays in the form of transudate, some exudate, having very little few germs, but the fluid is always gum-like fluid is filling the middle ear. So the conduction process, baby can hear, but very loudly. If parents are shouting, then baby is hearing. Normal hearing, only 10% is reaching into the ear. If we don't hear, we can't speak. If we hear nicely, we speak very nicely. If we hear Punjabi, we speak Punjabi. If we hear French, then ultimately our utterance, our speaking, our voice will be exactly in the same accent. So otitis MediaWithEffusion is fluid behind intact eardrum. Fluid, inflammatory fluid behind intact eardrum in a poorly treated, in a haphazard treated infections of the middle ear. And middle ear is round the clock filled with transudate or exudate. It's like gum-like fluid. If you see the old-fashioned gum having a cap on the top and the cap is misplaced, in initial few months, you can use it because it's liquid. After a few months, it will be hardened and solid. Once this transudate has got solidified, now you can't remove it. Even antibiotics won't work. So otitis MediaWithEffusion always presents with a delayed speech. 3 साल का बच्चा हो गया है, 4 साल का बच्चा हो गया है, but hardly he is speaking. And sometimes speaks, but the words are muffled, not clear. कोई तोतला कह रहा है, कोई उसको ये समझा रहा है कि 12 साल का इसका बाबा जो था 12 साल का हुआ था तब उसने बोलना शुरू किया था. Everything is myth. So Feeding bottle should be avoided. It should not be used after 2 to 3 years. If baby's hearing is not there, you are having little doubt at the age of 6 months, immediately get it examined. Small sounds when the baby is about to sleep or try to sleep, if you just have a small clap, baby should immediately wake up. With a very little clap, if your baby is aroused, wake up, cries, it's a very good news. Azan, on the first day, if you see carefully into the eyes, it dictates and tells you how is the hearing. That can be nicely noticed, even during first Azan process. Otitis MediaWithEffusion, fluid behind intact eardrum. So there are various names, just we said it like that. Otitis MediaWithEffusion, OME, glue ear, mean fluid behind intact eardrum. It is the transudate, exudate, having very few germs. There is no acute pain. There is no fever, but the baby is on a normal eardrum, is absolutely clean, grayish white, having some area like cone of light that glitters. That light is nicely noticed anteroinferior. Size is around 1 centimeter. Vertical size is around 10 to 11 mm. Here it is little less, 8 to 9 mm. That's the normal diameter of the eardrum. If you see fluid level here, then certainly it shows there's a otitis MediaWithEffusion. If the baby cries and moves the head, their bubbles appear on the surface. It's a diagnostic that the patient is having fluid behind intact eardrum. All these patients most often are having nose infections. Nose is blocked at night. They are taking feeders. Babies are at the expense of mates. Feeders are being used for 5 years, and feeders are even feeding bottles while baby is sleeping. Mommy says that baby can't sleep when he's not taking the feeder. So we take the feeder as a sleeping pill. That's totally wrong. So a normal, clean middle ear is at the expense of a good nose, good nasopharynx, and eustachian tube that connects nasopharynx, nose to the middle ear. If nose is fine, middle ear is fine, the hearing is absolutely normal. If the infection is in the middle ear, the patient can have intense pain. Acute, rampant, extensive infection leads to very severe pain that doesn't allow the person to sleep. It is so hard and harsh that it disturbs everything. So one should take care. When there is nose infection, throat infection, it can immediately be transmitted. Infection from the nose and throat can go into the ear. And in the ear, it can end up with a mastoid, post-oral, behind the ear, abscess formation, redness and swelling. And certainly, these are the very common causes of hearing impairment. In systemic infections, meningitis, especially the tuberculous meningitis, is very notorious. In Pakistan, the resistant cases of tuberculous meningitis are coming. That's a more troublesome and cumbersome problem. Typhoid and other very common issue, bacterial infections in Pakistan. So you may be shown such pictures. Patient can have acute suppurative otitis media, chronic suppurative otitis media is a discharging ear. Third possibility is foreign body in the ear. Bacche, even bade bhi kabhi, they try to put something in the ear. And foreign bodies in the nose, ear, throat is always very, very common. After feeding, another duty of young parents is keep things out of reach of children. Small things, pointed things, where the baby can put something in the ear, something in the nose is very common. If you see there's a foul smelling discharge coming since many days or many weeks, not settling with the antibiotics in a small child, if discharge is from the nose or ear, most common cause is foreign body, hidden foreign body in the ear. It could be acute suppurative otitis media if shown in OSPE. It could be chronic suppurative otitis media. That's a very common issue in a child. Eardrum perforation, you can see here, is a kidney-shaped perforation. It's a round window through perforation you can see nicely. So it's a handle of Milius here. So kidney-shaped perforation is subtotal perforation. That's the usual outcome of chronic suppurative otitis media. Chronic suppurative otitis media almost always is having perforation in the middle ear, in the eardrum. Child having right-sided mumps, and complications certainly will let you know deafness. Unilateral profound deafness is common. It can end up with pancreatitis. It can end up with the orchitis. In a small young babies, female babies, it can lead to oophorytis. So these infections are not only confined to the glandular structure here, can end up with the testes, ovaries, and even nerve deafness. So once shown this picture, you should remember always, if some mumps, it can end up with a serious complication. If the baby is having issue, he should be separated from other siblings. He will not go to school till everything is settled nicely. He has a viral disease. So you know very well in EPI program, even in Pakistan, its vaccination is included. So in reply, in exams, in Viva, you should be clever enough in telling all these aspects.
Sorry to interrupt you, just 3 minutes left.
Okay, thank you very much. I'm about to just wind up. I will recap on the next time, inshallah, also. Here you can say extensive parotitis, and mostly these are the cases of mumps. It could be bacterial sometimes. Mumps can happen in adults as well. Complication rate in adults in mumps is more than in children. So again, we should remember infections of the pancreas. This is a very serious disease. And of the ovaries infection, we should remember it. Measles, and another take-home message for 2 days, please don't clean the ear. Commonly asked question by internals and external examiners is, how often the ear should be cleaned? How often the ear should be cleaned? Ears should never be cleaned. There is no need of cleaning the ear normally. In normal life, in routine life, there is no need of cleaning the ear. Please don't clean the ear. It can cause perforation. It can lead to infections in the middle ear, so it should be avoided. If, for example, due to any reason traumatic perforation happens, then certainly we should take extra care that no eardrops, no water entry should be allowed. In 4 to 12 weeks, most often it heals, 80 to 90%. Those who will not heal, spontaneously grafting has to be done. So we'll just repeat that ear is a fine structure for hearing and balance, also for cosmetics. We should not touch the face. It's a masterpiece of God. And keep up your smile. And lastly, I'll not go through further slides because we are about to, I'll just repeat these words next time.
Okay, sir. Lecture time is over now.
Yeah, thank you very much. Thank you very much, dear students. We will be in